Welcome to our Monday Leo Live updates. And today he has a special guest. So why don't you take it away, Leo?
Thank you, Carrie. Great talking to you again, Carrie. Hope you had a great weekend, and all of you on the call. Really pleased that you're with us today. So I am going to move us along. Welcome. Happy Monday. I always do the state sort of status piece first, and just a admission that the Sunday report came in really late, and I didn't get to update it. The good news on the Sunday, so this is a Saturday update, so it's one day less than I normally do. But I have to tell you, even with the increased numbers, the best number of all of these is testing did outpace the previous week. Looking at Saturday's data, testing did not grow as much as the previous week, and I was surprised about that. And it really was the timing of the memo from MEMA coming out and the emergency management, group agency in Massachusetts. So I was happy to get that, and that 298,000, almost 299,000 numbers now over 300,000 of patients tested, and it exceeded the previous week's growth by several thousand. So we didn't hit a saturation point, thank God, which I was worried about. I also, despite the growth, you don't see the new numbers there, but they're slightly higher, but they're still below. The total cases grew, even though with more testing, slower than the week before, and the deaths grew more slowly. But of course, our thoughts are with, those individuals and families who have lost someone to this virus. And then here's a surprise today. This is a chart that if our Government Affairs Committee members got to see it a little earlier today, Representative Josh Cutler of Duxbury Pembroke posted it on Friday night. It's the first time we have this data in a coordinated form. I just want to give you guys a couple of caution on these data. And hopefully we'll be able to get it through the legislature every week. Just number one, that you should understand tests began a couple of weeks ago in all earnest with mobile testing, and look how, here's the good news. Look how many people got tested in a relatively short amount of time. And so we're talking about 7,000 people, staff and individuals with disabilities included. And of those, first place, that's 26% of our residential network got tested, compared to like 3% or less of our, Massachusetts general population. Just keep that in mind. There's 7 million people in Massachusetts. Are testing somewhere around $310,000 people, sorry. And there's 911 positive cases. There's over 1,000 staff positive cases, and there's 34 resident deaths. So, again, our thoughts are with them. And it's the good news is people are coming back from the hospital. People are recovering. And we hope that the pace stays low in terms of deaths. And I just want to again thank Rep. Cutler for releasing this. And remember, there's many more people at home living with families than you see here or semi-independently, not only here in Indiana and the rest of the country. So those folks are getting tested like everybody else when they have symptoms. And that's the key, is there's been homes where people have been tested, where people have been asymptomatic. So that's important to consider. And then one last piece that I want to do quickly is, I want to encourage you to go to our website to see the news, breaking news, and updates to catch up. I also want to remind you of the issues we've been focusing on that in the last week in the update that you'll see, which is around healthcare equity, financial support for the residential network, federal funding for states, services, and family caregivers, and special education. And I think later on the slide or in our update, actually look for the update and go online to see the update, that the fourth stimulus is looking for a number of things, including a 15% additional bump for home and community-based services. And remember the tagline, #We are essential. So let's keep that up together.
Thanks, Leo. There's just a quick question I wanted to, from Kathy. on the statistics. She was just wondering, are they just residential but not shared living or home or own apartment?
Great question. Yes. So anyone with family, so let me qualify the answer. And this is why it's important to think of the notes, the sub notes here. I just talked to a good friend and colleague who primarily does shared living and AFC. And I said, so how is your testing going? When do you do the testing, whatever? And he said, if we have symptoms, people go, the last week and a half or so has gone very well with our primary care practitioners getting testing. But are they part of the mobile testing? Maybe, sometimes if the timing's right, but if their symptoms come at a time when there's no mobile testing nearby, they're going to go through their PCP. 3 weeks ago, 4 weeks ago, well, 5 weeks ago, that was pretty tough, as you guys know, for all of us. But that has improved, he said, greatly in the last week and a half. So whether they're, yes, they're part of the 10,000 something plus people, but they're probably not going to be tested as in the same way unless the timing works. There's a mobile testing site opening up. And by the way, it's been wild. I'd say in the last 2 weeks, there's been, in addition to mobile testing going to residences, there's been at least 10 sites in the community across the state where people can go that is for persons with disabilities and staff and caregivers. So, and that's something the DDS, for people that are wondering about that, they can connect with their agency that serves them, or obviously DDS. But in terms of people living at home or semi-independently, they're subject to the same process we all are, the general population. So, and as we know, there's tens of thousands of people living with family and or semi-independently in some ways, right? So, we worry about them as well.
Yes. So those people, though, the people living at home are not part of the statistics.
Well,
that
for
you
sure,
shared.
if they're living at home, for sure they're not part of it. The number of the 10,000 plus, the includes shared living, right? But it doesn't include people at home. But even there, I tried to explain about the testing, it would be different, right? The way it would play out. Yeah, I mean, I think about it. The DDS caseload is about 40,000 people. And we know there's a lot of people not on the caseload that are either kids or, family members that just never signed up for Department of Development Services and come when they need the help. So, John Dickerson's been 42 years with the ARC. He's the former executive director of the ARC of Indiana. And I explained to people that were on early that he'd also worked at the national office. He's somebody who has spoke nationally in a different number of venues. He launched Quillo in 2018, and it's a new technology to strengthen relationships and organizations' culture. But the bottom line is to build better lives for the people we support and the people who work on our field. It's now in 12 states with a new version in development for families and people with intellectual and developmental disabilities. And you can visit the site and you'll have the link when you get the PDF, www.myquillo.com. So John, it's really wonderful to see you and be with you today. And we're going to talk a little bit, and let me get back to the picture here. Well, I can't see you, but you can see me. That's okay. And one of the things I wanted to get you started on, and you feel comfortable to talk about as you want, is what's the most pressure, given where you sit and the national view you have, and at least through 16 states, and of course you keep up with things through your relationships in the ARC and through your relationships with other organizations. What do you see as the most pressing issue that's come out of this COVID crisis?
Well, thanks, Leo. And I appreciate so much the opportunity to be with you guys, because the ARC of Massachusetts has done probably the best job in the country of connecting families, connecting individuals with disabilities, in your advocacy and using new technology. And so thanks for what you're doing and doing this every week. You do it extremely well. And Carrie, you're just a champion along with Leo and the whole team. It's really interesting. I was really impressed with your data. A lot of states don't have any data yet they're releasing about people that, oops.
Oh, you there?
Are we still, I'm still here.
All right, no, we're there. Go ahead. Keep going. Go ahead.
Okay. I see your smiling picture on the face here. So I think we have to look at this from different perspectives. Your data was great. I'm going to come at it from a little bit differently. Most of our attention has been focused on DSPs and residential, which is really essential. But you touched on it, Leo, too. The vast majority of people went home to their families. And the challenge we hear across the country is families of young children who are home from school, families who have come home from services, and they're figuring out what this new normal is, and the pressure on aging parents that are trying to keep up with everything, and this general sense of fear is significant. The transitions that we're making, that is almost exclusively in residential settings, changes dramatically from state to state. Ian was talking to people in South Dakota where they're still all going into the office. They've shut down their day programs, and they're now starting to talk about how they're going to bring people back and what should we bring them back to. So we're seeing the stress on families, we're seeing the stress on individuals, and we often aren't communicating about what this means to everybody. Man, and they're dressed head to toe in gear. You can't even tell who they are. And for him, that was more scary than just going to the doctor. So we actually created a new 60-second video that we're going to release on YouTube of just how going to the doctor is different. I mean, first of all, you don't go to your doctor, you call them up and they do a video with you. And then they decide whether you need to be seen by somebody and what happens with that. So the stress of anybody that has more challenging medical or behavioral needs, those families are just even more stressed on how do we deal with this. I just got a message that my audio is breaking up, so I'm going to turn my video off just to see if that helps with that a little bit.
Okay, good idea.
Yeah, and please make sure everybody's muted. I've muted a couple people, so sometimes it's a culprit too. All right, well, thank you.
And thank you for letting me know if we lose anything. In the residential side, we're seeing people struggling with the whole question of protective gear and how do they do that and how do they deal with all these uncertainties. One of the things that's interesting, we did a quick survey of our users talking about what's helping them get through as DSPs the most in this. And you know what they said? The support from their families and the families of the people they serve. That acknowledgement is so important. And I think that's true for mom and dad who are keeping their son or daughter at home. How do we support them through this critical time? The challenges are mighty. And on top of that, you've got the income questions for people that can't work, the uncertainty of when are we going to go back to work. It is just highly unsettling. So part of our role, I think, as advocates and friends, is how do we get any positive messages that are out there? How do we support people? How do we encourage people to deal with this new normal of they can't even have a birthday party? And so how do you find ways to connect with folks? How do you help somebody that is, this is a common question we hear from around the country. People have worked so long to get a job. I'm talking about individuals with developmental disabilities now. They've worked so hard to get a job and now they can't go to work. And they're not sure the place they are going to work is going to hire them back. And so how do you deal with that new level of anxiety? And one of our folks did some great things that they're having their folks that work out in the community that can't go to work write a note to their boss and just say, I'm okay. I'm missing you and I miss coming to work, but I'm looking forward to when I can get back to work. And think about that and think about the impact it has on everybody on various different levels. What are some of the surprising things? And we shouldn't be surprised. We're an incredibly resilient movement. We're finding people with creative ways to do it. One agency has started an entire Facebook Live curriculum. So on the hour every day, you can find different things to do on Facebook to engage people and to keep them positive, and begin looking at that along the way. They're finding ways, how can leaders show up for their families? And by showing up, how do we become visible more than just sharing the negative news of what's going on or that we don't know? How do we show up to support our families? How do we show up to support our staff and the settings that people are in? And technology is a great way to do that. But one agency, their leadership team spread out their whole agency and said, we're going to have drive-bys all through the week of just stopping out in front of people's houses and letting them know we're here and we're thinking about them. And even if we can't see them up face to face as we get looking at it. And the creativity that's coming out is really pretty remarkable from folks. That shouldn't be a surprise to us. Across the country, we're seeing differences. Congratulations to Leo and all of the team at the ArcMass. You've achieved some differentials for this time period to get increased funding. That's been really essential as we look at this, because all the rules are changing, even all the rules, how we'll report, how we will get through this. I was talking with some researchers this morning, and this is interesting. They are wondering if our incident reports during this time of the pandemic, incidents being things of that we don't want to see happen, abuse, neglect, those kinds of issues, whether the research after we're through all this, will it show, did those go up or did those go down comparatively? And their hypothesis was that with this new attention towards communication and support and talking to people, would we see actually incidents go down as a result of this as we pull together? And that could be more wishful thinking, but they thought we should study this and take a look at this. One of the big exciting points that's coming out that a lot of folks have reached out to us on is, should we just go back to the way things were whenever we come out of this? And I was listening to a podcast last night, and this fellow who writes for the New York Times said, you know, if we just go back to everything as it was, it meant that we quit thinking through all this time period. This is an opportunity for us to rethink what we were doing. Was it the best way forward? Was it the best life for people? And we should be thinking about, what do we want the world to look like post-pandemic? And does that mean we have large groups of people in settings together during the day? Does that mean we still have silos between people that work in day programs or in residential? Does it mean we look at people simplistically about their needs in one area without thinking about everything in their life that makes sense? I know you guys are a life course state, and I'm hoping that coming out of this, I'm a huge fan and believer of the life course model. Out of this, I think we can build another trajectory for people on the good life. That as we learn about this and the incredible job that families do, the incredible job that DSPs do, how do we rethink and maybe challenge some of our legacy thinking of how we got here? And what are the best ways we can move forward? And some examples of that of staff or leadership are going and talking to staff and saying, what have we done right? Throughout all of this, we know our shortfalls. We're working on those. We're trying to get you more gowns. We're trying to get you masks. We're trying to get you all these things that are in such short supply. And we're trying to get you more money. But what have we done right? What have we learned in this that could teach us things about what we should be doing better when we get out of this? And that becomes one of our real challenges. As we think about moving forward, I think we have to start thinking about, what do we want the future to look like? Because we don't know when we'll be out of this. Will it be coming around again? But what is it we want the future to look like? And as I talk to people around this country, I find there are far more people positive about the future than just worried about it. And I think we have to build on those positives and start connecting those people together and thinking about, what is it we can do and learn from this? Great suggestion came to me with the high unemployment. A lot of agencies are being able to hire new people, and they're bringing them in and training them. And somebody said, well, we used to have the mindset that these people might leave us and go back to their old jobs. And so we might only have them for 3 or 4 months. And he said to me, and he said, I think that's okay. I'm going to teach them about people with developmental disabilities during this 3 or 4 months. And then I'm going to turn them into ambassadors for us when they go back to their other jobs and say, would you think about hiring some of our folks? Talk about your experience. Tell them what great people we are. So I think that's an example of how do we use this opportunity to keep working towards what we're after. So I'm hopeful. I'm seeing a lot of innovation coming out. I'm worried about our leaders. I'm worried about our families, because we stretch people to extreme limits, and we've got. So that's kind of the quick synopsis of where I see things at, Leo, and that's where I hope we're going.
No, John, this is great. I think the future piece, first place, the drive-bys, I love it, that people are some of the things that people are doing. Number one, let me thank you for sharing some of that, because I think we always have to help each other, especially now that we're past the, this is only going to last for a few weeks mentality. But I think also the future, we know that big settings aren't always the best for people. So then what are the trade-offs we have to make, right, in the new future? So I think you've introduced, we're already talking with people about the fact that the day programs aren't going to be the same as they were, but what does that really mean, and how do we get there? So I just want to open it up, Kerry, for any chat questions, as well as I have some more things to talk to John about if we don't get a million questions.
Okay, I'm looking at the chat box. I think we're nothing yet, so why don't you keep going?
So John, one of the things in our state, we have the family situation where we've been successful working with other groups in terms of the residential safety net. We have people stuck at home, and I was asking some of my colleagues earlier today at the Government Affairs Committee meeting, what would just giving money do? They were feeling like that's not enough, because what would they spend the money on? The families that are stuck at home, not able to work, right? Because the day programs are closed or out of district schools are closed. And I asked him how many people are really struggling in tough circumstances, and he described that, and probably described it as under 10%, but that are really in extreme, situations. And one of the things that hit me was, well, if we did give larger stipends to families, we'd be at least decentralizing our plan of support to where they could, think about maybe a cousin could room in with them during, the day to help out if they have a son or daughter with significant 24/7 needs, right? Whether it's behavioral or medical. Because there are people right now who don't have significant support at home, like you were describing, John, earlier in the discussion. But I don't know if you've seen creative things that people are doing for those families who don't have enough PPE, so they're nervous about different people coming in and out.
Right. That's a really good point. One of my close friends, they're worried. They have a staff member that will drop in and see them once a week, and they're worried about, do they need to take this person's temperature when they walk in the door? And their daughter has asthma and some severe respiratory problems, and so they're just very concerned. I think people are looking for sources of things that they want safe information. That right now we're being bombarded with a lot of information, and most of it is scary.
Yeah.
If you listen to a friend of mine who's a psychologist, Robert Nassis out of Philly, he said, limit yourself to 30 minutes of news a day, because it'll drive you, just pardon my mental health friends will be upset, but it'll drive you crazy if you just keep hearing the same thing over and over again. But you also have to focus on some news to be informed, but focus on what is it that is positive and what can you do to begin keeping those links. And if you can't see friends in person, call them on the phone. The other thing that's interesting, and this was in a school corporation, just share this. Sometimes we think that we can't do certain things because we just don't know how. 26,000 students in the school corporation in Phoenix. And the leadership of the school took every staff member, teacher, janitor, bus driver, coach, everybody, and divvied up those 26,000 names. And they each had a group to call every day. Wow. Just to check in and say, how are you doing? So I think we can do wonderful things with social media. We can do a lot of things, but we have to keep it back to that personal of how we can do that. We can see this. So we begin thinking about it. There's a question on the chat that I want to get to here with Deborah, that, you know, her daughter lives at home and goes to a day program, and she has hired somebody to come in to help. And she says, this worker can testify to the fact that my daughter behaves differently in both places. I'm hoping she can take this information back for them. There's a really interesting lesson there of what is it that makes that happen, and how do we translate that back? I'm sure we've got examples of people that are learning what they really like doing and do more of that, and learning also what they disliked and where, quote, those behaviors come from. You know, one of the great things that I learned from some folks in another state is, if we start finding out what gives people joy, then how do we do more of that and do less of the things that they really don't want to do? And how do we begin pulling it out and learning from that in the pieces of the equation of what does make a good life? We're talking with people that are going through conversations of people in their homes and asking them, again, going back to the life course model, you know, and saying, you know, when we go back, what is it you really miss and you want to do? And what is it you don't want to do? And use this time as a chance to really explore and begin thinking about things in a different way. Another home that I talked to was interesting, where they're trying to think of creative things to do. And they asked people in the home, and this would be interesting, we tried it with my family, it was really eye-opener for conversation. They asked people in this particular home of 4 guys living together, what is your favorite thing in the home? What is the thing that gives you the most joy in the home? And people were surprised at what people picked out.
Wow.
And one of the guys walked over and talked to one of the young men that works with them and said, "You're my favorite thing in the house." And the guy almost broke down. So as we start looking at what we can't do, how do we build up our gratitude for the things we can do and that which we have, and begin sharing that with folks? So I think there's a lot there that we focus on. What are those positive emotions that we can have? Yes, we can't go to dinner with somebody at a restaurant and sit and see our friends and see how they're doing. Or we can't go into the office or into work and begin looking at that. And we also can't solve every problem for every family that's out there, but we can have empathy for everyone. Jumping back in, Leo, with one of the things you said, I don't think we know how all our families are doing. You know, Indiana's about the same size as Pennsylvania. We have half the data that you have, and we have no data yet on people with IDD. We have anecdotal reports of people that have refused the testing because somebody comes at them with a 6-inch swab and wants to stick it up their nose, and no way they're going to allow them to do that. So out of all this, we've got multiple factors we've got to think about. You know, the health risks, the financial economic risks that we're going through, and then the loss of what was routine. And the expert psychologists that we've talked to and work with is, we've got to help people find new routines. And new routines that focus as much as we can on the positive as opposed to the negative. And sometimes sometimes things happen. We've got to adjust. Saturday, I was working on the yard, and I did something stupid and pulled the cord that connects our Wi-Fi to the house. So all day Saturday night and Sunday, we were without Wi-Fi, which today is an essential.
No. Wow. Yeah.
And we found, well, we talk to each other more that way. So how do we find those ways to connect and do it? And not forgetting that the people we support want to talk to their friends. They want to see people. We teach them to Zoom. We have one of our groups, the Down Syndrome Indiana, is doing Saturday morning dance parties where you submit your favorite songs, and how do you begin doing that? And they just dance in front of the computer with each other. And it's now become one of their most popular things they've ever done before to be able to do this. So how do you find that? How can you watch a movie together? There's an app called Cast, K-A-S-T, where you could watch a movie together with your friends remotely on your computer and be able to do that. So I think we can find ways. My friend Ben Drew at Open Future Learning has been sharing a lot of messages, and we talked the other day, and he has something interesting. He said that for most of us now, we're experiencing social isolation. And social isolation for a lot of people with developmental disabilities was a reality long before the pandemic, that they didn't get the same opportunities that we had in those times to go see friends and do things and have that opportunity to do that. And so one of his dreams is, as we come out of this, and we've all learned about social isolation, that we don't let that happen again to people along the way of what we're doing.
Excellent. Good. It's a good way to close out the topic. I think we're talking about what's really going on. This is substantive, John, and you're helping us be focused on some of the key elements of life today and what we can do to make life better. So first, thank you again for being with us today and the work you're doing at Quillo, myquillo.com. And check it out, folks, as well, and see what it's like. I also want to just let people know with this PDF or this PowerPoint, we're going to send you the week's update, and it's going to touch on the accomplishments in the healthcare piece. It's going to touch on the accomplishments around the safety net and some of the other things. But at the end of the day, all that work is about what John was just talking about today. It's about our lives, better lives, great lives in the community, and that's what we want for all our friends and family. So thank you for being with us. Thanks all of you. And Carrie, do you have anything closing you want to do? We want to remind people about, I guess, the rest of the week, what's coming up as well. And of course,
Sure,
donate to the ARC. Don't forget that. But go ahead. You want to just summarize the weeks you're on tomorrow? Who do you have with you?
So I hope, you can join me tomorrow
at 11.
At 11, and I have Dot Lucci from NESCA,
Great.
and Dot's going to be talking about managing stress and anxiety, because I know how, this is stress and anxiety is affecting everybody. So just ways you can manage and get through the day. I'm also excited to offer something very unique. We have an artist who has actually experienced kind of a tough go in life. He has something called Horner syndrome, and he was homeless. He, is now living and working and is using art as a tool to really help him manage and get through life. And he's going to be sharing a lot of his really very neat techniques he's doing. So I'm excited to offer Scott Brenner.
It's a learning opportunity for everybody in terms of art.
And for anybody.
And that's Wednesday. Yep. When's that? Wednesday?
That Wednesday at 1:30.
And that's right after the agency leadership thing I'm going to be doing with Brian Cusack at noon, right?
Exactly. Yeah. And then, of course, Maura will be on Thursday, giving us any kind of updates from the state perspective. And Friday, Ellen will be talking with, I believe, some of our Congress. They'll be joining us on Friday at noon to talk about what's going on with the federal
Now,
government.
last week, did she end up having folks from Senator Markey's office? Was that last Friday? That I think.
No. It was Kathleen gave an update on the special education.
Of course, I went on and listened to it on the weekend, and I'm like a numbskull. All right, sure, that's right. I actually looked at it later in the library, so which was helpful. So yeah, thank you, Kerry, and thanks everybody. And we'll send you information on the other two that are not on this list, not part of our regular list. So God bless you, and let's keep everybody in mind. And thank you, John, again for a wonderful core lesson about our humanity and these times.
Well, and thank you all for showing up. I mean, each of you will touch so many people, and Leo, I'm just, again, you do a tremendous job. And Carrie, I loved your topics that you've got laid out, and good luck. We'll get through it.
Well, take care. God bless. Take care, everybody.
Bye-bye.
Bye-bye.